So my practice is Dental Health Spa. It's on the High Street of Brighton, just 5 minutes down from Brighton Station. We're 10 years old this year. I have a great team of dentists and hygienists. I suppose what we're all about is patient-centred care. I'm a hygienist that owns the business. I was one of the first in the UK to set up and manage a business, and it was about letting people walk through the door to see a hygienist before they saw a dentist. We see a lot of patients which have high levels of anxiety, so our practice ethos is all about patient care. So that whichever member of my team you'll see, you should expect to see the same level of care and empathy from each and every one of them. A lot of patients that we see have high levels of anxiety and come on recommendation for others. So it's all about what the patient wants and how we get them to the end of their journey. It's hugely important. If you don't know what you're looking for, if you don't have the necessary information to hand, how can you make the right choice? So giving people the right information about the right treatments in a format that they understand is really important to help them make the right choice. It makes it easier for them and it makes it easier for us. Absolutely, a huge increase. When I set up in 2007, it was just ahead of the first biggest recession. And actually you'd think that a business wouldn't survive during a recession, but people still care about the aesthetics of their mouth. So with that comes hand in hand an increase in cosmetic treatments, especially whitening, Zoom whitening. People tend to put a name to whitening now, like we do the Hoover. So we have a huge proportion of people that actually contact us about teeth straightening, whitening, and non-invasive cosmetic treatments. Well, obviously Zoom whitening is going to be one of them. Airflow, air polishing, because it removes stain and makes teeth look naturally whiter, but it also delivers really good health benefits. And bonding, because bonding's non-invasive and it involves putting teeth into a better alignment without actually destroying the teeth or taking any teeth away. Okay, well, toothbrushing is the number one, okay, because mechanical removal of plaque is the most important thing you can do. So you should brush before breakfast and last thing at night before you go to bed. I recommend an electric toothbrush because I think technology's changed like everything else. We live in an ever-evolving society where we use Fitbits and other technology. Electric toothbrushes enhance the time you brush for. They encourage you to brush for 2 minutes, which you should brush. They allow you to get further in between your teeth, but it doesn't remove everything in between your teeth. So we should be looking at other things to clean between our teeth with. And I always say to people, if you brushed your teeth 6 times on the outside, it wouldn't get to stuff in between. So you have to clean in between them. And I'm not a big advocate of flossing because people struggle. So brushes that you can use really easily. There's new products now which have taken on the role of some of these brushes that are really flexible because the bacteria that sit in between your teeth sit there the longest. And if you brush and don't get in there, they're going to stay there forevermore. And it doesn't hurt to add a mouthwash to the end of it. Not to replace a mechanical action, but to give incremental value. So it'll remove and kill a lot of what you leave behind. So brush, clean in between, use a mouthwash, plenty of sleep and watch your diet.